Now let's talk about breast pumps and milk supply. Breastfeeding works on a very simple physiological principle. Milk is produced when it is needed. In the first days and even the first couple of weeks, your body produces milk generously because your brain, specifically the pituitary gland, does not yet know how much your baby will require, so it produces more than enough. Then supply adjusts. The rule is simple. The more the baby removes, the more the body produces next time. If you begin using a breast pump very frequently, in the first days especially, when the baby is sleeping, you can overstimulate production. Many mothers panic because in the first 1 to 2 days their breasts are not swollen or engorged. They don't feel fullness. They don't feel pressure. It doesn't look like what the internet describes. That is normal. In the first days, you produce colostrum, a thick, yellowish early milk. Just a few drops are enough for a newborn in the first 48 hours. A newborn's stomach is tiny. Supplementing with formula in the hospital without medical necessity can interfere with the natural establishment of breastfeeding. In U.S. hospitals, supplementation is recommended only if medically indicated. For example, significant weight loss, low blood sugar, or other concerns. Otherwise, frequent skin-to-skin and frequent offering of the breast are enough. Milk usually comes in more noticeably around days 3 to 4. Until then, do not panic. Every time your baby wakes, offer the breast. Offering the breast does not always mean active sucking. Sometimes the baby just lies against you, smells you, feels your warmth. Skin-to-skin contact stimulates oxytocin, and oxytocin supports milk production. Is not special lactation tea that builds supply. Warm fluids help because they relax blood vessels and ducts. But expensive miracle. Lactation products are often marketing more than medicine. Stress, however, truly affects milk flow. When you are anxious, adrenaline rises. Adrenaline constricts blood vessels and milk ducts. Prolactin and oxytocin work best in calm conditions. From an evolutionary perspective, if a mother were running from danger, milk flow would decrease because survival comes first. So if you feel that milk disappeared, often it is not gone. The ducts are simply constricted from stress. This is why in the first days after birth, your world becomes very small. There is you. There is your baby. There is your partner. Everything else can wait. The wallpaper can wait. The crib assembly can wait. Household problems can wait. Calm establishes lactation. Calm prevents clogged ducts mastitis risk. Calm protects your recovery. And again, avoid unnecessary pumping in the beginning unless there is a medical reason or your pediatrician lactation consultant recommends it. Oversupply can cause milk to spray forcefully. The baby may choke, gulp air, spit up more, or develop gas discomfort because they swallow too much air while trying to manage fast flow. Also, try not to let your baby become extremely hungry before feeding. A very frantic baby will latch roughly, gulp air, and swallow quickly. This can lead to gassiness and more spit up. Newborns have an immature lower esophageal sphincter, so milk can come back up easily. This is common and usually normal. Now, let's talk about you again. Eat regular meals. Drink water. Do not fear hospital food. True colic does not begin in the first few days. It typically appears around 2 to 3 weeks of age. In the immediate newborn period, you can eat normally unless your provider has given specific dietary instructions. Rest in the hospital. This is recovery time.